constantly calling the patients, how are you feeling, can you get back to work, what can we do to help you, so.
These ladies have done a boatload of work with Packers. And Packers has done a boatload of work to try to minimize this whole thing and what have you. I personally went through Packers when they were closed and all the changes that they did, and pretty amazing, they did a bunch of work. I mean, I don't know how many dollars of plexiglass they got in that place, but they spent a lot of money.
I don't know. I work with Japanese, Chinese people all the time. The Japanese people are very clean people, and this is owned by Japanese company. And I think the Japanese company that was owning this, they were on it. They wanted, the CEOs, you do what you gotta do. We gotta pay whatever we gotta pay to do it, because they spared no expense. And they bought masks for everybody. They had dispensers out there. When I went out and worked the COVID testing, we registered online. They had big dispensers all through the parking lot. When you get up there, you had to hand sanitize, you had to have your mask on, and it went really smoothly. And they were feeding the people in line, they were giving them water, they had snacks, I mean, they went all out. I have never seen a testing site like this.
Painted all the hash marks
Yeah.
to keep people 6 feet apart. I mean, they've got that, they essentially line up now in the mornings, so.
Yeah, I mean, it was amazing, just the testing. I've never seen a testing site like that. Even ISDH, when I was out there, they were telling me, wow, we've never been here. They got snacks for these people. If they go through the line, they gave them something, water and a snack while they were waiting, and it was amazing. I was really impressed.
How many total positives did Packers have?
Two something,
Yeah.
low twos, 220,
So, I mean, I think the
Right.
results for
Yeah.
what they did kind of speaks for itself.
No, how many did we have?
It was-
Much different.
Yeah.
8 to 10% of their employees.
Left, yeah, I didn't think about 8%,
6
less,
to
or
10.
something, very small.
So,
Most of them were Tippecanoe County and Cass County.
and this may sound a little weird, but the state was actually in contact with me and essentially begging me to make them stay open. Because they were worried that the employees would go home to their families and not go to work and go to other places and actually contract it there, and then take it back to Packers and spread it through Packers. And so the state was actually asking me, once they saw the facility and all the changes that they had made, they were asking me to keep it open. And so I had a conversation with the CEO to say, will you stay open? And they're like, well, we can't take that legal risk. And then I think Trump signed the ordinance or whatever for meat packers, and so then they opened back up. And we think there probably was a fair amount of those positives that had family members, contacts with Tyson already, so. I mean, it's hard to keep track of all those numbers, but probably some came from there.
Okay, thank you. Valerie, did you have anything else you?
Oh, yeah.
Please.
Okay, well, I sent everybody the COVID pandemic event report that I had to do for the state. It's not the complete AAR that, preparedness does at the end, but, they didn't want the AAR, they don't have time to go through them, so they just wanted a summary of what every county has been doing. So I just wanna tell you a little bit of what we've added to exactly what my position has done, and IPC testing, resulting, reporting, and contact tracing. We follow up with all the patients' care and return to work. We worked on their attendance, sick leaves, and many discussions with ISDH about their facility closing. Met with nurses, superintendents, custodial staff on closing the schools, their cleaning process, PPE, making out graduation protocols, and their reopening guidelines, the DOE. Threw that in our lap, and the schools were great. We talked, this is, what we wanna do, what we think should be done. We kind of worked together, but ultimately, you know, we said, it's your call, because we don't want to decide whether your children are gonna wear a mask or not, we can only recommend. I can only do what the state health commissioner asks of me, and she asked me to recommend that they all wear a mask. We can't mandate it, and the governor doesn't wanna mandate it, so, the schools are, you know, they have put in lots of hours, and Joyce and I put in lots of hours just trying to come up with what we think will be a good, happy medium for everybody. Churches, I've been to numerous churches and went through their closings and helped them with their guidelines for a drive-up service. I've walked through the churches for their reopening plans and their PPE and how they're gonna social distance and how they're gonna do that, and how we're gonna do contact tracing with, the people that do attend church, so they're still doing it virtually, so we can go back to the tapes if somebody gets sick, and we can contact trace to see who they sat next to, who they were around. Obviously, with the courthouse closing, the protocols and moving forward with Governor Holcomb's back on track, and the PPE and the cleaning and the reopening protocols here, that was a huge undertaking. And with that, meetings with Family Health Clinic on their protocols and how they were gonna do they did a testing site there for a short period of time, only with their patients. They didn't do anybody else's testing, only if you were a patient of Family Health Clinic. And met with, you know, to meet the state health officers' guidelines and testings. Valley Oaks Mental Health, I went through their facility, their protocols. What do we do for your patients, because you're gonna have more mental health and problems with all this closings and social distancing. And so I met with them. Carroll Manor and Saney have been absolutely fantastic, and I've worked with them, and we're all working well together and giving them supplies of PPE and their plans for their reopening. And now we're working on visitor restrictions and outdoor visitation. Now they can have indoor visitation so many hours, and how we're gonna, you know, do the contact tracing there. I've had many phone calls with the libraries on their reopenings, and child care facilities, the community clubs, and what can we do to social distance in there, and how can we make sure they're 6 feet apart. And you know, it's hard for little kids, don't understand this, but we've done the best we can. We distributed PPE to all the dentist's office, chiropractic, optometrist office, and I'm proud to say, I was the only district that supplied PPE to our funeral homes. Because these funeral directors have no idea when they get this body, is it COVID, is it not? You know, sometimes it's marked, sometimes it's not. If you've got the HIPAA regulations, we can't do this, we can't do that. So I jumped on the bandwagon right away and said, hey, these guys need the PPE. They all got two total outfits, and I said, if you need more, because I got them Tyvek suits, they were decked out, so if they needed it, they had it. I don't think any other district, they're like, I've never thought about the funeral homes, but I guess owning one, you know, you just kinda do. We've worked on the fair protocols, the guidelines for their PPE, the Bacon Festival, Old Settlers, Tractor Pulls, Memorial Day, July 4th, festivities, parades, ongoing protocols with the restaurants and local businesses. Obviously, we've all decided the Bacon Fest, you know, the Old Settlers, we can't afford to do that. I mean, there was 10,000 people at the Bacon Fest last year. You know, if everything's closed, everybody's going to get out, and we'd have 20,000 here. So we finally just came to the conclusion we had to stop that. We've had many Zoom meetings with local businesses, ISDH, which is Indiana State Department of Health, and congressmen and commissioners and council members, fielding phone calls about all these possible exposures, concerns, results, and testing, and what am I gonna do since grandma has it now, and how are we gonna, you know, social distance and quarantine. We've had to do a lot of documentation about the PPE that's been dispensed. I have ongoing documents for PPE, writing daily reports, even on the weekends. I'm writing these reports every weekend. These girls, I come in on Monday and my computer's making this ungodly sign. They're like, what is that? I go, that's what, at 7 a.m. it starts on my phone, and these are the reports that we have to do. But we're doing all of our logging of all our PPE. We met with Dr. Dutter weekly on updates, protocols, document signing, and, this, this pandemic is gonna be ongoing for a while. These were my, my deliverables, all of this for this grant period. Well, in March, they suspended the rest of the, deliverables, the things that I have to finish for my grant to get my money. So they suspended it. My grant for this year ran out June 30th. My new grant started July 1st, and I gave you a copy of my new grant. So I've been working on my new grant. So not only do I have what they call, in the back of it is all the deliverables, the attachment A is everything that I have to finish the deliverables to get our money. So I have to do all those deliverables plus what I didn't get done because they suspended it for this year. So I am asking that the Board of Health, since this is a part-time job, but it's become pretty much a full-time job, and all these grant deliverables that they want, and they've increased our budget was $25,000, they've increased it to $31,899 this year. They felt like we should get a pretty much a pay increase and to help with the PPE. So I'm asking that my salary ordinance be changed with the council. And I'm only getting $12 an hour right now, and I'd like it to be 15, because most of my counterparts in District 4 make $25,000 and up. They're salaried, and I'm an hourly person. But this grant is 100% reimbursable to the county. So my salary does not come out of any county money. It's all paid through the state and the federal. So it doesn't affect the county's budget. And so I'm asking that my pay increase to $15 an hour to make me comparable with the rest of my counterparts. I mean, Tippecanoe County, they're making $30,000 and up for their preparedness people, but they get more of a budget too. And Joyce and I, we've scrambled and gotten all this PPE, and we have stockpiled more PPE for next year, and we think we're really prepared for the fall. And so.
We met in Lafayette at 7 AM when places are open
Yeah.
to just buy up
We were
whatever money, bring it back.
We were scrambling, okay, you go to this store and you see if you can find Lysol and wipes, and I'll go to this store and
Life hands and diamonds.
whatever we could find.
I'll meet you at 7.
And I don't know how many of you board members know, I know Doc does Stalker, but this position's been a revolving door in the past for us, and it's just been kind of somebody there, somewhat going through the motions. And I would say if Valerie has not been in this position, we're gonna have way more cases, we're gonna have more deaths in Carroll County, we're gonna have whatever, chaos in Carroll County. And I think that's a small price to pay.
You're gonna be missing about 4 other people in the health department, what you're gonna be missing.
Yep, including myself.
Yeah.
I wanna add too, that the Amish, the horse and buggy we had one guy, he made it to a phone somewhere, every week he called me for a report on what they could do about going to church. So they were interested, and they stayed home and didn't have church for a while. But, we told them they could space the buggies like they did with the car parking lot at the churches. So car park, can't have your doors open, you can't pick anyone else up, and he called for weeks, every week he called me for a report. And then I had one from the Mennonites that came to town a few years ago, he called me, doesn't live too far from me, but he called me every week, wanted to know what the report was. If we had a new, thing the governor gave, we printed that, he came in and picked up a copy, he made me these two, I want a copy of it. So they were all interested, and I think they did a good job.
Valerie, how long have you been in this position?
I started in 2009, and in 2016 I moved to Pittsburgh, Pennsylvania, and then I moved back to, after 2 years. And then, I was talking to Joyce one day, and she goes, the position's back open if you you know, and I thought about it, and I just really love it. I've loved it from the beginning, and when I started in 2009, I was just a chirp clerk, which means I just put in all the immunizations. And somebody else was the preparedness coordinator, and that person up and quit in March, and Joyce said, why don't you just take that? I'm like, oh, I don't know if I wanna take on, all of that. And so I talked with the State Board of Health, they came, my District 4 rep, and she talked to me, because at the time, you had to write all of the plans had to be written, and they came through and they graded your plans, and you had to get 70 or above. And I said, is this doable? Because nothing was written, there wasn't one plan written on anything in Carroll County. And she said, it's gonna take a lot of work. And my plan book is now this thick. And so from March until I got graded June 30th, I worked night and day, and I worked on the weekends, and I fly, but sometimes I'm in the airport and I sit for 4 hours. So I'm on my computer finishing up my reports and my protocols, and I did that for a long time. And when we got graded, somebody from Chicago that came down to grade, because Indiana has Illinois people grade and vice versa. And we got an 86 out of 100. So I was pretty proud of myself, because in that short a period of time. So I've been doing this for a long time. When I started, it was a salaried position, and somehow the last 2 people that were working this, it got changed to an hourly position for $12 an hour. And, it's just taken a lot of my time. Like, Angie's like, you got a meeting at 1 o'clock on Wednesday? Yeah, well, the state said that, Or I go home, like last night, after the governor announced 4.5, I'm getting texts, emails, and I'm getting emails at, on the weekends, 10 o'clock at night. And I feel like these people want an answer, they want it now. I need to answer it. I can't just put my phone down, because this is an ongoing pandemic, and you just can't walk away from it. People are, begging, what do I do, what do I do? You've gotta give them an answer.
And it changes by the minute.
Yeah.
So the information changes, number one, and number two is the calls and the population change. So it starts with wherever you wanna start.
I know.
Churches, and then it's schools calling, and then do we cancel, and then
And then somebody on
now you've got
Facebook.
the whole other spectrum. Can we open back up safely again, and when do we open, and what do we do to open? And it's every pastor calls, and every teacher calls, and then you have parents saying, well, my kid can't wear a mask, and so all these parents are calling, and it's just a.
Well, and I know Dr. Flora and Dr. Hopper, it's, you're home, you're reading what the WHO's putting out, what ISDH is putting out, what the CDC is putting out, and how do I combine all of this? And so I'm constantly reading all the updates when I'm not working, and, that's what I do for entertainment now, pretty much, and watching all the news and see what's going on, so.
We kept it going, what?
Do we have a cap of 15? Does the state
No.
cap that at 15?
They don't, I'm just asking that,
Yeah.
my grant, that I haven't got my budget there because they haven't sent it back, but they agreed to $19,000 a year. I don't know if I'll make it to 19,000 with the hours. That's what the grant says that I get paid. They're gonna pay me 19,000 this year.
You have to have so much money left to buy supplies
Yeah.
and restock what
But they
outdated
come up
emergency
with
trailers.
the amount, the state, they give me, they say you have to have 5,000 for this, and you have to have 5,000 for that, and you've gotta have this much. So, for my salary, they're giving me 19,000 this year. I would love to be salaried and pay me out 19,000. I don't know if the council would agree to that, but I feel like I'm worth more than $12 an hour that I'm being paid now.
$19,000 for a year, at $15 an hour is 24 hours a week.
24 hours a week. And I'm putting in.
It's not much.
No. And I'm putting in much more than
That's
24 hours.
52 weeks,
Yeah.
I hope to take a vacation.
So I was,
Could,
But I can pay for my vacations.
could your grant stand $16 an hour?
can my grant stand? I didn't check that one. I don't know. Are you looking that up, Chris? I don't know what.
It's 22 hours. And $60 an hour equals
Yeah.
$19,000.
but,
Why don't you just salary it and,
I was gonna say, can't you do the salary?
I always was salary, and for some reason the council changed it to hourly, and really, it's I mean, they put it in the salary ordinance, but it's not money that the council has to spend. I mean, it's reimbursable, they pay me and the state pays them, all the way, I mean,
What was your salary before they changed it to hourly? You know?
Their ordinance said,
I
Or
think.
I was just curious.
In
what it was
2000 and,
before.
I think in 2009, it was 14,000.
I was gonna say 17, 15.
Yeah, cause it's pretty much been 25,000 every year until this year, and they bumped it up to 31,899 for, because I don't get a phone, I'm using my own personal phone for phone calls. I don't get paid holidays, I don't get benefits through the state, and so I think the state is trying to compensate us for what we are going to do and what we're gonna have to continue to do and what may come down the pipe.
Before Valerie came back, there was 1 year of Angie and I think, was it Shelley was in the position? Shelley was in the position of vital records, and the three of us took on the grant, went to the meeting. Of course, we didn't have the pandemic, and we didn't have that much to do. We had mandatory meetings, got 25,000, I think, that year, and we didn't get paid anything, because they wouldn't let us have money, because the county was paying us, so we got to use it all for supplies, so if we had to restock, and that's how we got some of our supply stuff there too, because we didn't take any pay out of it. But yet, we kept the grant going, and then got her back.
I do wanna say one thing, this has not been an me, all about me, I have not done this alone. This is an entire team effort from the beginning. I mean, from Joyce and Kathy and Angie and Randy, they've all been there for me. If I go to Randy and say, hey, I just got this phone call about the restaurant, he's on it. Or Angie and Kathy, hey, we've got this PPE, can you go pick it up? Can you look up and see where I can buy PPE? They were on the computer constantly trying to outsource everybody to get the PPE that we needed, because it was so sparse everywhere. Gloves were the hardest thing to get for us, gloves and gowns, because I had all the masks and everything. But, this was a total team effort. I did not do this on my own at all.
And we got a little flack about having people in the health department that were not essential as well.
We couldn't have done it,
There's
because
no
they
way
fielded the
that we could have
calls,
done it
and
without.
where I'm on this, with the state, writing reports and getting answers from them, emails and everything. They're answering the phone calls, because it was just, that phone was just nonstop, ring, ring, ring. And Kathy was hired in the middle of it. And so we're trying to teach her her job, but throwing her into this pandemic, hey, you gotta answer this phone call or field this, so it was a total team effort. I'm not taking credit for this at all.
So I'm confused, this, you may have said this, now, this grant for 31,895 is supposed to include your salary and some equipment, right, Joyce? Like, what's supposed to come out of this?
Okay, all of your PPE, we bought a trailer and we restock it with, Joyce and I have everything in there, from obstetric kits to suture sets, suture removal sets, because,
OB kit.
everything that we would have to have in case of a pandemic, because we don't have a hospital. So we've tried to think of everything we can.
Okay,
If we have to support St. E or Carroll Manor, because, they're running low on their
these are
supplies.
emergency preparedness lines,
Yes.
not your vaccines, don't
No.
ask about this,
No,
not,
Yep, we got that emergency trailer with everything, we bought that
gotcha,
the first time she was here, so we've had it, but we have to keep restocking with certain things outdated.
sure,
And
expired.
it's kept down to EMS garage here in Delphi.
Gotcha.
Didn't we kind of use H1N1 money with that, so was that was with you?
She was here when we bought that.
9 or 10
Yeah.
probably.
I was here when we bought it, yeah.
I'm thinking it was 11 or 12.
It's an amazing, if anybody's ever not seen it, it's been at the fair for a few years, but it's totally stocked with everything. We even have a little refrigerator, and we got a generator, we've got tents, we've got tables, we've got everything we could, not just, supplies. And her son put shelving in it. People go, you got all that in that little trailer, But, and we even have a lot, clerical supplies and
So how much was this grant back when your salary was in 14 range, 14, 15, whatever it was?
It was 25,000.
Right, so, I mean, if you were getting 19 and it's 31 now, I mean, that would be comparable to what it was, still having that much left over. I mean,
Yeah.
I would think it would be reasonable to say, well, why you wouldn't just be salary position? And, you know, if the grant goes up because, as time goes on, and there's more expenses where, does that need to be revisited and adjusted? It seems like it would make more sense to me to do that instead of an hourly rate.
Yeah, I would prefer that, but, I don't know what the council will wanna do. It's, I guess because it's not, county money that they have to account for, it's paid to me by the state and the federal government. I mean, the federal government gives it to the state, they decide how they're gonna split it up amongst the counties, so.
Now, this grant's already approved, right?
This grant is approved, that's the signed grant you have right there. Yeah, it's been approved, and, I've already started working on this grant. I mean, this grant started July 1st, so I've already been working at $12 an hour since July 1st, because we haven't been able to meet with the.
Can you submit a time card, or what happens if you work 40 hours a week?
There is no time card, everybody has a time sheet they write down, and, I mean, these girls Randy Cleaver can get on my computer and see how many hours I'm on that thing and what I'm doing, it's not like it's a hard thing to,
Yeah.
backtrack or, but,
Oh, no, I'm not saying that, I'm just wondering how it's.
yeah,
I think
that's,
it's like, and Dr. Stoffer, you can correct me if I'm wrong, but when I was hired in at a salary amount.
Yeah.
But my timesheet says an hourly where they have it broken down, and then you get paid per hour that you work, you don't get paid. I mean, it works out the same amount so long as you have the right amount of hours. But it's a salary amount, but yet it isn't because you get paid by the hour.
I was
And that's-
told that too, Andy, I was
And
salaried
that's how
and
all,
I'm hourly.
and that's what I'm saying, if you can put her in at salary, but they're gonna pay her by the hour. Cause that's how they do the whole county.
You take the salary and say this is what you get and divide it by 26 pays, and there's one year now and then that you get a 27 week, you get extra pay week. And that's what they do, they take your total amount that they, by hour, really, and then they divide it by the pays, and that's what you get.
If I work all my hours, I get my salary amount, but if I'm gone and I don't have vacation days, I don't get paid for that, so. And I think, I might be wrong, you probably know more than I do about it, but I think the whole county is like that.
I don't know, before I worked before, my paycheck was the same every 2 weeks, but I was putting probably the same amount of hours in, I don't know.
So what's your supposed part-time hours per week?
Well,
Not what you actually work, what they're paying you for, which is not so sure.
how much I
18.
actually,
Yeah, it's 18 hours a week.
You're supposed to work what?
I had to be in the office 12 hours, but you can't do this job and be in the office all the time, cause you have to go out and work. So, I'm working before I was working anywhere from 16 to 20 hours before the pandemic hit, every week, so.
Yeah.
Honestly, I personally don't know the ramifications of changing from hourly to a salary. I don't know personnel wise, but I'd be,
And we just ought to take 25% raise and let the council figure it out.
I think I'd better give the council a number, do you think, Doc?
yeah, I think either the hourly or a salary.
I think Angie's right, even if you label it as salary, they're gonna break it down by the hour and say, here's how much it is hourly.
That's why I kinda came up with $15 an hour as part-time.
Okay.
It's considered a part-time position. So, even though I'm working more than part-time, and I will continue to work more than part-time because of the situation,
I remember this from a couple of years ago, even though it's not the council's money, they have to.
They still have to put their, or they still have their thumb on it, yes.
And, yeah,
I would recommend $16 an hour, let them come back to us.
I like that.
Second.
Got a motion and a second. Request, increase in Valerie's salary to $16 an hour from $12 an hour. Any further, any questions or discussion? All in favor, say aye.
Aye.
Opposed? Carried. Nay.
Thank you.
Thank you.
This week, this pay period was the least I had, was 84 hours this time, so.
Very good. You have anything else?
I don't have.
Anybody out there have anything?
We discussed this last time, didn't we?
I know Dr. Stopper and Dr. Dutter know, but the rest of the board probably doesn't know, but I emailed a company in Indianapolis, that was, they were hair products at 5:30 in the morning on a Saturday or Sunday, can't remember what day. Cause I saw it on the news, they were making hand sanitizer, and so I emailed the guy. He emailed me back at 8 o'clock on Monday morning and said, we'll give you 600 bottles of it, but you have to come and get it, south side of Indianapolis. So I said, Andy, you wanna make a road trip? And so I said, not gonna send anybody by themselves, so I sent Kathy with her. So they go get the hand sanitizer, bring back 600 bottles, and 3 weeks later, I sent them another thank you for it, and said, are you still making it? And they said, we're making it this week, and they give us 600 more. I think they ended up with 500, and it was close to 600, but they said they'd give, we got 1,200 bottles of them free.
We got-
Department to get free.
We got free
No,
PPE
good
from
stuff, too.
Purdue.
It's
And
good
it was
stuff,
the good
too.
stuff too.
It was the good stuff, had the gel.
Mansfield
It was the
King.
gel, it wasn't the,
That's right over there.
I don't know what
Yeah,
your
it was over there.
company made. It was Mansfield King in Indy, and they make hair
Yeah.
products, and they stopped making, started making hand sanitizer. They were little, but hey, they last a long time. We
And a
don't want it
professor
every
at
office.
Purdue emailed me and said he had PPE and what we need, and I was, I was just so grateful for that, because we needed the face shields at the time that we couldn't buy, and I needed those for the people that are on oxygen, that can't wear the mask, because they can't breathe, and so it was a really blessing from them, so. Yeah.
Well, I just want to commend you guys on doing the work that you have done. Therefore, when this all kind of started, managing a Great Harvest Bread Company in Lafayette, there was a need there. Every time I was looking at an email, it was changing, and I was texting Jerry, and I was like, okay, we gotta do this, this, and this. And to be able to get the things that you must have to protect our county is incredible. We had a week that I was down to 3/4 of a gallon of sanitizer and was not, I was like, I don't know what we're gonna do. I mean, we can't get stuff.
Right.
It's terrible. So I just wanna commend you for protecting our county the way that you guys have.
Thank you. It's, I have to actually say Carroll County did it themselves, because they have social distance, and for the most part, people are wearing the masks and trying to stay away. I mean, we've had parties for graduation, 4th of July, but we're lucky we live in a rural area that we're not living on top of everybody. So, I think a lot of people, we have a lot of elderly in the county, and they're really concerned about getting it, and they've done, tried to stay away, and so.
So
I-
thank you for all of your guys' work.
And I can't say enough about St. E and Carroll Manor. I just wanna sing their praises all the time, because Carroll Manor these girls are not even allowed to work, they aren't even allowed to work 25 hours a week. They don't get any benefits, and they have put their heart and soul in keeping that COVID out of Carroll Manor. I mean, they wipe everything down, nothing goes in, the blizzards are outside, they wipe it down, it sits. Even the mail's wiped down, they don't even pass it out for 24 hours, and they've just done an amazing job, every one of them. Can't say enough.
Little CD.
Yeah.
And took it out of there.
Yep, they've done a good
I
job.
had a TV station call me, well, they emailed me every week and wanted an update on our long-term care, so I had to answer them back. I don't know how many weeks in a row they sent me an email every
Wanted to-
week and asked,
How many people we had?
how many long-term care do you have and how much COVID and how many deaths do they had? And I emailed back, well, we have 2, they have no COVID and no deaths. So,
That's a
they
tremendous
said that-
thing.
that's
It is.
great.
These-
How many do they have this week?
These,
USA Today.
Boone County is.
USA Today.
yeah, oh yeah, that's right, we even got USA Today, how about that, so.
I didn't know that.
Yeah.
We did.
They
Yeah.
emailed a couple times.
Yeah, so, yeah, I mean, these nurses are working their hind ends off too, you know, just, and then try to stay safe and not take it home to their family, I'm just, yeah, like I said, I didn't do this alone, it's a whole county-wide thing, and this entire health department has put their heart and soul into this, so.
Okay. Looks good to me. September.
October Thursdays, 1, 8, 15, 22, and 29. Oh, that's 15.
That's fine.
October 15th, 6:30.
Very good. Well, certainly, want to thank everybody for coming, participation. Entertain a motion for adjournment,
Motion. Second. Second.
so be it, thank you.
See, the one meeting that I missed, they had come, and I can't remember what the deal was, but.
See you guys.
Thank you.
See you later.
Kind of a blessing, because I